For this scan, like all others, the goal is to get the probe in the student's hand as much as possible. And we're going to be looking at the long ultrasound here. So our indications for this are things like respiratory symptoms, signs of any respiratory pathology like pneumonia, pneumothorax, any uncleared chest X-ray findings that you want to explore more. So for acquisition-wise, in our IAIM, you want to use your linear probe. Several different views you can get on the anterior chest and also on the lateral chest. We'll just focus on anterior here. Use your linear probe, indicator towards the patient's head. So just when you're going through pointing at different anatomy, start with your skin and then your ribs. Any ribs you find, you're going to have your shadowing, which is the black shadow down the screen. So you want to get your window right inside adjacent ribs. Then you're going to have your muscle and your soft tissue, and then your pleura. So on this, really big, most important thing is to show the what a normal pleura looks like. So on just B mode, you're going to see, it's been described as like ants marching, just between the visceral and parietal pleura, just what looks like little ants moving back and forth. So once you point out that in the anatomy, then you can go to M mode. Have your proctor breathe, so take a deep breath. Deep breath. And what you're going to see normally is what's called the beach sign. So your M mode is going to look like a beach, water, and then the sand. And then to kind of simulate what a pneumothorax would look like, you can ask your proctor to hold his breath. Hold your breath. And then this is going to be the barcode, just like a barcode across the screen. In a patient with a pneumothorax, this is what it's going to look like, but because it's not detecting any movement of the pleura. Management-wise, if they have a pneumothorax and you're going to proceed to needle decompression or a chest tube, other pathologies you can find with the ultrasound are pleural effusion, which you can tap, and then use Light's criteria to further diagnose it. Other kind of tips, when you're looking for pneumothorax, you want the patient supine. For an effusion, more kind of upright. Any consolidation or interstitial pathology really doesn't matter what position they're